Hey everybody, how's it going? So on the first episode of Jeremy Oliver's TV, we talked a little bit about stem cells and PRP, and I just want to take some time to present some of the research that I have discovered actually as of recent of August 2021 of the latest research that I found and that I basically summarized. And so I want to share that with you so that you can know the latest on stem cell and PRP therapy and see if you're a good candidate for this, okay? So first thing to understand is the process of muscle healing, and be aware that for me, it's important to be aware that it's directly related to the functional disability of a person that has some muscle injury. And I kind of went down that route more so during the episode 1 podcast. So you just got to understand, just to keep it very general about the healing process, is that these muscle injuries, skeletal muscle injuries, they heal in 3 phases. And we call them the destruction, repair, or remodeling phase. There's all kinds of different names for it: inflammation phase, proliferation phase, maturation phase. Those are also your 3 other names to describe. But think about it as like phase 1, phase 2, phase 3, okay? So once you understand that there's 3 phases, then you also have to understand that the size of the injury, the size of the tear of the sarcoplasm, or I don't want to use too much big words, there's a size of the tear of the muscle, depending on severity of the muscle strain. These phases can last longer or shorter. So all of that's going to vary on the severity of the injury. Also, understand that all these phases kind of overlap and they sometimes occur simultaneously. And so that's another thing to keep in mind when you're thinking about the healing process and maybe getting some plasma rich protein or asking your physician about it. So first thing is, or next thing after the healing phases I want to talk about is actual stem cells. So muscle stem cells are satellite cells that they're actually located outside of the muscle that is going to undergo the same process to become normal tissue again, more normal myofibers, right? Fibers of muscle. So these newly formed myofibers then they adhere to connective tissue sheaths and they form mini musculoskeletal junctions with the scar. And over time, the scar shrinks and then, things start to heal again. But unfortunately, this healing process, as some of us already know, this regeneration process slows down with age. So sometimes, older athletes later in their careers, or, somebody who is a little bit older in age might be interested in something like this to assist with that. So, all right, now let's get specifically more into plasma-rich protein. So this PRP therapy is produced, like we talked about in the podcast a little bit. Just going to go over it one more time. It basically is produced by centrifuging a person's own blood and extracting the active platelet-rich fraction that's left in it on the bottom of the tube. Okay, and then this little bit, by the way, centrifuge is they put your blood in a little tube, spin it around really fast. And on the bottom, what's left is this platelet-rich plasma. And so the leftover is then injected, this platelet-rich plasma on the very bottom that separates. It's going to be injected into the injured tissue, and that's going to enhance tissue healing. So that's the idea behind PRP. So the biochemical rationale behind the use of that is that PRP is a bioactive component of whole blood, and it has a higher concentration of basically platelets that, compared with like our normal blood. So if I was just going to get normal blood and put it in there, it's not going to have as high of a concentration of this PRP, this platelet-rich plasma that's left over. So this PRP can sometimes contain up to, research is telling us, it can sometimes contain up to 1 million platelets or more per microliter. So this PRP is thought to have increased concentrations of white blood cells, and they contain something that we call cytokines, and enzymes and growth factors rise linearly with increasing platelet concentration. So basically the combination of these bioactive molecules that exist within PRP, they actually play an important role in biochemical processes of the body, which include some of the phases that we talked about. Like they actually have an anti-inflammatory effect. They increase capillary permeability, vasodilation, keratinocyte proliferation and differentiation. Basically, they're just helping to bring more nutrients to the area. Okay. Now, since muscle healing occurs, like I talked about, in these overlapping phases of inflammation, proliferation, and remodeling, they're coordinated by growth factors and from cell to cell interactions. So the muscle injury healing can be enhanced by PRP, because we talked about the cell interactions and the growth factors that can occur with that plasma-rich protein. So PRP injections can lead to increased satellite cell activation. Remember, we talked about in the beginning, this is actually these exist outside of the muscle. And satellite cells, or these stem cells, are kind of like the mother cell, and the daughter cells, some authors call them, are specialized cells that get transferred throughout the body. So some of the three most commonly treated muscle tendons, chronic muscle tendons, the research is saying, is a lateral epicondyle, which is the outside elbow, the Achilles, and the patellar tendon. Rotator cuff tears and elbow epicondylitis, they're also commonly treated conditions as well. Good to know. So if you have any of those conditions, those have been heavily researched, and it might be something interesting to bring up to your physician if you're suffering from that. Early use of PRP has also, and on low to moderate severity of injuries, they've actually benefited the most compared to high level severity injuries. So if you have a chronic condition, you have some lateral elbow epicondylitis, or some other condition like that, tennis elbow, golfer's elbow, Achilles pain, anything like those injury areas, those are important things to, possibly bring up to your physician as something that you might be a candidate for. So there's indications for that, for the use on those injuries. So like we talked about in the podcast, I also have to talk about it again. Some of the most important things are to communicate with your physician about PRPs, the complications or the contraindications, which I'm sure all of you would do anyways. But if your physician doesn't, you need to prompt that, because as healthcare professionals, we have a duty to do no harm. I wouldn't want to perform this on somebody that this is a contraindication for. And some of the contraindications are patient's medical history, specifically related to bleeding disorders or previous adverse reactions to PRP in the past. Those are two contraindications so far that have been heavily researched in the literature. In addition to that, it would also be wise to document and talk to your physician about any existing medications that you're taking, because non-steroid anti-inflammatory drugs, NSAIDs, they have been shown to inhibit fusion of the myogenic precursor cells that impair muscle healing while it's used with PRP. So that's also very important to bring up, and because it wouldn't make sense to pay all that money and get PRP and then you're popping NSAIDs at the same time, right? All right, so it's important to get the inclusion and exclusion criteria out of the way, because we talked so much about patient-centered care, right? This isn't just good for everybody. There's important things that make someone a candidate or not. So let's turn more on a positive note, contraindications. PRP and it actually has a decreased risk of harm compared to the risks that have been associated with other foreign blood products. So that's a good thing. I think it would also be important to understand what platelets are. I know I've mentioned that already, and I haven't even defined it for you guys. So platelets and their function within the body. Platelets play a role in tissue regeneration, anti-inflammation as well, analgesia and function, antimicrobial activity, and coagulation, right? So these platelets are very important for a lot of things, right? So I think you guys know what tissue regeneration and anti-inflammation is, things like antimicrobial activity, coagulations like, blood clots, which we need if we get cut. Very important to have that scab form. So therefore, there's kind of varying levels of evidence for each area and its indications for use. But overall, the evidence does support the use of PRP, and I would recommend it for, or the literature is recommending it for small and medium-sized rotator cuff issues to reduce re-tear rates, some of the other elbow tendonitis, chronic Achilles, patellar tendon, those common sites like we already talked about. I would look into using this for. They're going to help to decrease the symptoms caused by the chronic tendinopathy, and it'll also have greater beneficial effects in the early phases of injury repair. So it's better to get this done in that inflammatory proliferation, those first couple phases, rather than wait for something that is more in the maturation phase. So following PRP, I think it's important to then understand that have the person understand that this is relatively harmless. Show them the body parts and places that they need to get this done, and also to decide on which type of PRP technique and dosage should be used. And those are discussions that you'll have with your physician, right? But that is what the latest research is telling us on PRP injections and stem cell research. So the rest is up to you to make your decision. Please talk to your healthcare professional, your provider, and make a decision from there. So I hope this information helps you, and enjoy your day. Have a great day. Bye. I plan on following up on some of the podcast episodes with missing bits of information that I want to expand on, and we might not necessarily have time to talk about on the podcast. So if there's anything that you want me to expand on in any of the episodes that you hear, just please leave a comment. That's the only way I know, guys. So please leave a comment or message me or email me. Find a way to let me know that you want more information on that. I'm researching things all the time, so I likely have information already on it. And if I don't, I have access to a huge database that normal people usually don't have access to. So I can help provide you with as much information as I can related to musculoskeletal injuries, injury prevention, any of those things. So if you're really enjoying this, please subscribe to my YouTube channel, Jeremy Alvarez TV. You can follow me on Instagram, Jeremy Alvarez 22. Plan on putting little clips on there. But yeah, just support this channel if you're enjoying what you're hearing. Thank you.
Perfect.